Hello friends, good morning, good afternoon, good evening. Today I'm going to talk about an article published on 29th of May 2020 in the Lancet, which is an international medical journal, online first. This is regards to mortality or deaths and pulmonary complications in patients undergoing surgery with COVID-19 infection. This is an international cohort study. The impact of severe COVID-19 infection on post-operative recovery needs to be understood to inform clinical decision making during and after the COVID-19 pandemic. This is a very extensive study, reports 30-day mortality or deaths and pulmonary complications rate in patients with a perioperative COVID-19 infection. This international multicentric cohort study at 235 hospitals in 24 countries like USA, UK, Spain, Italy, France, and many other countries, included all patients undergoing surgery who had a COVID-19 infection confirmed within 7 days before or 30 days after surgery. The primary outcome measures was 30-day post-operative mortality or deaths were assessed in all enrolled patients. The main secondary outcome measure was pulmonary complications because COVID-19 virus affects the lungs, defined as pneumonia, acute respiratory distress syndrome, or unexpected post-operative ventilation. The analysis includes 1,128 patients who had surgery between January 1st and March 31st, 2020, of whom 835 or 74% had emergency surgery and 280 patients or 24.8% had elective surgery and 13 patients or 1.2% status is not recorded. COVID-19 infection was confirmed before operation in 294 or 26.1% patients, post-operatively in 834 patients or 73.9%. 30-day mortality or deaths were 23.8% or 268 out of 1,128 patients. Pulmonary complications occurred in 51.2% or 577 patients out of 1,128. 30-day mortality deaths in patients with pulmonary complications was 38% or 219 of 577, accounting for 82.6% or 219 of 265 of all deaths. That means 82.6% or 219 patients of 268 deaths had pulmonary complications. Before COVID-19 pandemic, high-quality multinational observational studies established overall baseline rates of preoperative or postoperative pulmonary complications up to 10% against COVID-19 patients of 51% and subsequent mortality or deaths up to 3% in a normal conditions, and in COVID infected patients 23.8% after surgery. In adjusted analysis, 30-day mortality was associated with the male sex versus female, age over 70 years versus less than 70 years, high risk for anesthesia, grades 3 to 5 versus grades 1 to 2, cancer versus non-cancer diagnosis, emergency versus elective surgery, and major versus minor surgery. Postoperative pulmonary complications occur in half of the patients positive with the COVID-19 infection and are associated with high mortality or deaths. Threshold for surgery during COVID-19 pandemic should be higher than during normal practice, particularly in men aged 70 years or older. Soon, when hospitals recommends routine surgery in this pandemic, this will be in hospital environments that remain exposed to COVID-19 virus and increase the risk of postoperative complications. So the important message from this multi-centric article is consideration should be given for postponing non-urgent surgical procedures and promoting non-operative treatment to delay or avoid the need for surgery for now because of high rate of complications and deaths in COVID-19 positive patients. Thank you for watching this video.